Hi, I'm Christopher King. I'm the Associate Medical Director of the Advanced Lung Disease and Transplant Program at Inova Fairfax Hospital in Falls Church, Virginia. In this video, we'll be discussing the prostacyclin pathway. We mentioned in some earlier videos, there's four main pathways that lead to development of pulmonary hypertension and have available treatments for them. And so the prostacyclin pathway has been the one that we've had treatments for the longest. And so PAH patients have a decrease in production of prostacyclin. Prostacyclin is a substance that is released by vascular endothelial cells, so the cells that line your blood vessels in the lung. And these prostacyclin medications act by binding to prostacyclin receptors, which can lead to dilation of the smooth muscle in these blood vessels and can cause pulmonary vasodilation and also anti-proliferative effects. And what I mean by that is they can reverse some of the remodeling of those blood vessels that leads to narrowing. And so this is a diagram that shows different places that these medications can act on. There's some that have multiple receptors that they can bind to. Some, like selexipag, just bind to the IP receptor. It's not so important to remember exactly which receptors they affect, though, but more that these medications can lead to these effects of pulmonary vasodilation and potentially reverse that proliferative process. These medications are probably have the most variety and the most options. So there's multiple ways to deliver these medications. And the choice of the therapy and the way that we deliver these medications is really based on a lot of different factors, to include the severity of illness. For instance, in patients that are very, very sick and at high risk from their pulmonary hypertension, we may choose to deliver these medications as an intravenous infusion or subcutaneous infusion. In other instances, they can be delivered as a pill or an inhaler. So of the medications that are available, there isn't one oral treatment that's a prostacyclin receptor agonist that binds that IP receptor called selexipag, which goes by the brand name Uptravi. It's an oral twice-a-day medication. There's also epoprostenol, which is, again, a prostacyclin agonist, and that's available in intravenous form primarily. And in ICUs, it's sometimes used as an inhaled medication, but that's not something that our pulmonary hypertension patients are treated with as an outpatient. Treprostinil is probably has the most variety of all these different medications. It can be used in intravenous form, where it's under the brand name Remodulin, although there's a generic IV treprostinil available now. It can also be delivered in a subcutaneous fashion. It can be an oral medication, and when it's used in that manner, the brand name is Orinitram, and then inhaled as an inhaled medication. There's multiple companies that have versions of this, and some of the brand names are Tyvaso and Eutrepia. The mechanisms that lead to pulmonary arterial hypertension are complex. They involve multiple pathways and potential treatments that can affect these multiple pathways. There's a lot of different medications that are available that can be used to affect the prostacyclin pathway. And your pulmonary hypertension specialist will have to take into consideration your particular situation, the severity of your disease, your ability to care for these medications, tolerance of side effects from these medications, and develop a treatment plan that works for your particular situation. Thanks for your attention today. For more resources, please visit phassociation.org.